everyone, welcome back. I'm Dr. Samina Mitha, naturopathic doctor, and today I want to talk about sleep and PCOS. Sleep is such an important foundation for good health. I often like to think of sleep as one of our major pillars to good health overall. We actually require deep and restful sleep to really carry out and restore many of the body's functions. A good night's sleep can actually prevent heart disease, lower inflammation, impact our weight, support our healthy immune system, improve concentration and focus, improve mental health, and could also prevent type 2 diabetes. So let's talk about common sleep issues with PCOS. First of all, insomnia is actually defined as the inability to initiate and maintain sleep. It also includes prolonged periods of wakefulness throughout the night. Research actually shows that women with PCOS are more likely to have sleep disturbances than those who don't have PCOS. So it's really important to help women with PCOS figure out what are the causes of their insomnia or lack of sleep, and also what can we do about it. Oftentimes we see in PCOS the common difficulties are difficulty falling asleep and staying asleep. So let's talk a little bit about the common factors that we see with sleep disturbances. First and foremost is obesity and insulin resistance. Due to the fact that PCOS is a metabolic disorder, insulin and glucose are often impacted. Insulin resistance is actually commonly seen in women with PCOS, and this can lead to weight gain and furthermore, obesity, which can then increase our risk for something called obstructive sleep apnea. This is where we have frequent cessations of breathing during the night. So we actually have this experience of like our breath is stopping multiple times throughout the night, and this can occur alongside other sleep disturbances. Second is cortisol and mental health. We actually find that women with PCOS have an increased risk for anxiety and depression. And we know that when there's anxiety and depression, it can also impact our ability to fall asleep and stay asleep. We know that anxiety can also really impact our ability to calm our nervous system down and also calm our busy brains down, especially when we're trying to go to sleep, which is very common from what I see with my patients with PCOS. So it's really important to help the nervous system and calm cortisol, especially when there's sleep issues. Other lifestyle behaviors that we commonly see that can impact sleep are things like smoking, alcohol consumption, and lack of physical activity. Okay, so let's talk a little bit about naturopathic treatments. First and foremost is always diet. Diet is, really the root of how we can help the body overall. We know that with diet, if we improve insulin sensitivity, we can actually help insulin resistance and ultimately help, these women with PCOS lose weight. The way we do this is eating high fat, high protein, and low carbohydrates. This allows insulin to lower and results in allowing the body to lose weight. Ultimately, this will help to reduce things like obstructive sleep apnea. Okay, in terms of supplementation, there's so many supplements out there to reduce cortisol, but I'm going to talk about one that's really important, which is called GABA. This is an inhibitory neurotransmitter that actually quiets down the nervous system. It's actually been shown to lower anxiety and increases relaxation. GABA can be used as a supplement to help with sleep as well, in dosing of about 100 to 200 milligrams. Additionally, there's other supplements that can help to increase GABA, such as magnesium bisglycinate and L-theanine. When it comes to botanicals, we really want to use herbs that help to calm cortisol and help us to balance the cortisol curve. Oftentimes, when we're trying to go to sleep, our cortisol tends to rise. This inhibits our ability for melatonin to rise so that we can get into this restful sleep. There's this one botanical that's known for its ability to balance cortisol levels, known as ashwagandha. And in a study in 2019, it actually showed that ashwagandha at 300 milligrams twice daily improved sleep quality and onset of sleep. There's other herbs that can also improve GABA, which is things like passion flower and valerian root. These, these herbs also help to reduce anxiety. Last but not least is lifestyle and sleep hygiene. Sleep hygiene is so important when it comes to helping you fall asleep and stay asleep. The reason why is because it also helps us to bring our cortisol levels down. And like I said, once cortisol is down, at the end of the day, melatonin can rise so we can get into this restful sleep. Oftentimes, start winding down your day about an hour or two before you're going to sleep. So turn off all electronics at least 1 hour before bedtime. Make sure your room is dark as possible. Start to dim the lights before you're starting to get to bed. Make sure you have comfortable bedding because this can really help calm us down and also help to get us into a relaxful state. Creating a calm and zen-like experience in your room is very important. That means reducing and removing clutter and maintaining this relaxing environment is really important. Oftentimes, if you have lots of things in your room or lots of, piles of stuff, it can actually cause anxiety and impact our ability to fall asleep. Sleep at the same time every night. This will help to maintain your circadian rhythm on a daily basis. You can actually consider sleeping in the nude because this actually helps reduce body temperature and helps us to actually fall asleep. Your room should really only be used for sleep and sex only. Try not to bring any other activities into your room so that your brain doesn't associate your room to other stimulatory activities. Also try reducing stimulatory activities before bedtime, like watching TV or, even a really intense conversation can actually throw you off sometimes as well, or even drinking coffee too late in the day or the nighttime. Avoid eating sugary snacks before bedtime because this can lower your blood sugar and then wake you up in the middle of the day, or sorry, in the middle of the night. So if you want to eat a small snack, it should be something like high fat, high protein. Keep exercise to the morning or mid afternoon and try not to exercise right before bedtime. And if your mind is busy, try to make your to do list right before you go to bed. That way, it's down on paper and it's out of your brain. Maybe even take a hot shower or bath before bedtime. I often find this is very relaxing to help calm the body down. Avoid napping throughout the day unless it's for 20-minute power naps, and really develop a calming bedtime routine. Maybe it's reading a book, drinking a tea, meditating, listening to music, doing a little bit of yoga before bedtime. All of these activities can really help get you into a calm and relaxful state. Hope this was helpful, and if you have any questions at all, drop them in the comments below, and I'll see you in the next video. Take care, guys.